Welcome everyone to ALN Thursday at 3. Today, we've got a little different take. We're talking with Frank Estala, Senior Compliance Auditor for Integrity Services at University Health, the first hospital in the world to be ISO 55001 certified and then recertified. And then I believe another recertification, or at least in the process of a second recertification. But before we do that, we always like to thank our patron members and our organizational members. Without them, we would not be able to do these types of programs. And we're very grateful for their support. So Frank, how are you doing?
I'm doing good on this fine Thursday on a Texas sunny day.
I'm in Chicago and it's cold and overcast. Texas is looking much better. It's been a while since we've talked. You were gracious and were on our 2020 annual event when University Health had an hour of conversations with the CEO, Mike Rousseau. Am I pronouncing that properly? And it's not CEO. What's the title at a hospital? Administrator, right?
Yes, hospital administrator.
Yes. And Art Kurland spoke with you then also. But we wanted to talk with you specifically because you played a very important role in the University Health ISO 55001 certification. You were the internal auditor, and I'd like to find out what that entailed. And then I'm sure you also interacted with the external auditors, ABS quality evaluations. I believe that was the auditor for your certification. Is that correct?
That's correct.
So first of all, how did you get to where you're at now?
That could be more than a 30-minute show. So, but I've always been in auditing from out of college. I used to audit funding that came funneled through the federal, through the state levels in a form of council of governments. And then with that, I worked my way up into executive director with some nonprofits. And then I also went and did auditing with pharma in clinical trials. And then I moved on to go into the academia as a compliance auditor for research, human subject research. And then finally, I was recruited by University Health to be an internal auditor here. And I've been here now going on my 6th year.
And in general, what does internal auditor mean at University Health? What do you do?
So we're at this point, we touch the face level of, or what I call the surface level of auditing. And so we're focused, first of all, we're focused on risk-based work plans. And then from that, when we do our work plan on focused audits based on those risk scores, we then go and conduct an audit, primarily looking at internal controls with various departments from that work plan. And then once we have our findings, we provide that to leadership and implement the appropriate means of any type of management response for corrective actions.
Excellent. So doing ISO 55001 was just the natural extension of what you do.
Yes, absolutely. And in fact, I would have to say, and one of the things I would want to promote to other hospitals is that being ISO certified has become really a plus because it does carry a little bit more stringent pillars in terms of how to be compliant than most normal compliance departments in healthcare. And so given that, it provided a good structure within the asset department in maintaining and building internal controls for compliance. And so I think it's been a plus, and I recommend that any other healthcare system implement ISO standards as the baseline for a compliance component that they're going to implement. In this case, we're trying to expand into not only asset, but facilities management ISO, as well as hopefully in the long term to include IT.
So when you say assets, that was the personal property assets. That's what
correct.
got things started with. And now you're looking into facilities and hopefully IT. Well, that's great. So what was involved from your end in the ISO 55001 certification process?
So from my end, we start, of course, from the ground up. We start to see what the regulating factors are to obtain certification. And in this case, asset management had a SAMP plan that needed to be implemented. And so with that, I looked at the components that our asset management department had and to create things like their committees, the staffing, and then the mechanisms that they were going to utilize in terms to accomplish those goals. So for example, how would they be tracking? How would they be reconciling? And from my standpoint, from the audit, what testing measures were we going to utilize to reconcile that type of testing?
Okay, so what was being reconciled and what testing did you do?
So the reconciliation was part of comparing what was ordered in terms of POs and compared to, we have a process where once items are received, they are also tagged. And so within that process, our asset department utilizes a platform called WiseTrack, where they utilize that to track and maintain all the inventory, and even if it's within transfer. So that was a baseline of the testing as to comparing what POs we had. So from the auditing standpoint, I would get a sample of POs that had purchases and assets, and then I would follow from the beginning as to, well, one, was it tagged at the dock? And if the answer was yes, then I wanted to confirm where the asset had landed, testing the platform on WiseTrack, which is what they were utilizing. And so that was a testing measure, and those were the reconciliation. And that's just, I mean, I can get into more detail on that. And so furthermore, it was now comparing, once they gave me that, I would pull up data also from procurement and compare to validate if those assets were ordered and received. And then the final testing was to, okay, tell me where these assets are currently housed, or where are they at, or where were they transferred. And with using their WiseTrack data, then I would reconcile the two so that they matched, and it gave me a confirmation as to where an asset was currently being held, and whether it was tagged and followed or not.
So this is all activities that I would think a hospital would be doing anyway, but this just gave it structure.
I think it gave it more structure, but it also gave it a little bit more teeth, because once it had certification, we have a department that actually maintains and sustains what certifications we have. So we have some very certifications that require lots of oversight when it comes to sustaining, such as one, we're a magnet school for nursing, we're a trauma one center. And so once that department takes over, then that's when they reel in the internal audit department. And that was part of also the certification process as well. But on a normal basis, we would not audit asset management unless we had a concern come in either to hotline or if we deemed it high risk in certain areas. But once it became ISO certified, and these standards were supposed to be done annually and then recertified every 3 years. So now we're looking at it with more scrutiny than we normally would have. But I think it's a plus. I think the asset department welcomes that because it kind of keeps them a little bit more in check as to have a tighter knit as to where all the personal property is being accounted for. And what I'd like to bring out in this is that, I guess the next question, if I may proactively say, is to, well, what did you discover in this process, right?
You took the words right out of my mouth, Frank.
So what we discovered in this process is that we're such a large network as far as the health system. We have over 10,000 employees and probably about 40 satellite and ambulatory clinics. And so that poses a challenge for someone like asset management. And so what we've discovered is that because turnover happens in areas, and we realize that many people that had financial decision-making capabilities, in this case, part of their job was to be accountable for the assets, were not aware as to what their role was to be the ownership to any assets that their departments were responsible for. So for example, like asset management has a liaison that does a survey that notifies them when an asset's going to be transferred or disposed. And so we learned that many of our managers and directors were not aware of their role in this part. So then with this, so what the chain reaction that this created was, in one of my audits and in one of my findings to the asset department, was that there was no training involved. And so those are two things. So one, an HR issue where directors were not aware of what, or clearly definitively aware of what their roles and responsibilities were as an asset owner, but also that they didn't really get the education either. So that kind of posed that to Art's group to say, my finding and my recommendation is to create a training program that would be provided to people in these roles so that they're aware of what the asset management tracking system works and the functionality is. And this would allow them to have asset management more accountability, but also more awareness to management throughout the health system.
That's a huge benefit.
Yes, yes, it was a real huge benefit, and that also provides more training opportunities in Arts Group, but it also provides more awareness to HR to have orientation where it covers what their roles and responsibilities are. And as a whole for the system, it applies for more compliance and more awareness with tracking assets. So I think that's the biggest plus that ISO has done so far. The chain reaction to this, well, now we have facilities management that is very, very interested and are trying to transition into ISO certification after seeing our asset department go through this function. And so that's a big plus, is now we're seeing the chain reaction that hopefully now our next one will be IT. But our current process, our current state right now is that facilities management is working to get ISO certified as well.
Oh, that's excellent. So let's get back into your activities and what you did for the certification, because you've been through the original certification, which must have been more difficult, and then
Yes.
I hope the recertification. So can you tell us what you were doing for the original certification?
So I think the original certification will, and what I would advise anyone, it consists of the organization. So who are the key stakeholders? Who's going to be part of your committee? Who's going to be your champion to kind of run and tell people in certain leadership the importance of it? We have our department that maintains our certification. So they were also roped in, which they're part of risk management. So all these keys was trying to put together a team as to how are we going to accomplish this, and who can we champion to assist in pushing the initiative. And in this case, Mike Russo's was also, one that championed for us because he was a hospital administrator. And so I think the first part of certification, the hardest thing is organization, and then assuring that you have the resources on those roles that are going to accomplish the missions and goals of reaching that certification.
So was the ISO 55001 certification more extensive than other certifications that you audit?
Yes, it has been. I mean, we have JCO standards. We do have our magnets school status in nursing. But as an auditor, I can tell you that the testing measures are, I think, a little bit more strenuous because of the amount of data involved of the assets, the amount of assets involved, and then the amount of ambulatory clinics that are all over the place. And how do you follow up and keep up with these moving parts? Sometimes they go to one location to another. Then you have transfer of leadership that they're not aware of, and then they move things. So all this was the first part, was to really organize, was the most, I would say the most difficult part was to organize first. Then now, once you've organized, and second certification coming is more about, okay, how are we going to test appropriately? Are we ready to test fully into what the outside auditor is going to be looking at? And so the good part is our outside auditor is really good about giving us about 4 months, letting us know when he's coming. So it allows me to start pulling data early to see how we can test for accuracy and reconciliation in terms of illustrating how that audit turned out and making it easily and readily available for outside auditors to come and review.
So Art has helped me understand that hospitals are very aware of the value of certification. Their people, their doctors and nurses are always being certified to and recertified. So the concept of certifying to ISO for the hospital was, there wasn't much resistance. Complex, as you indicated, but there wasn't resistance from what I understand.
Correct. And I think the reason why there was not a lot of resistance, and again, something that I would promote and I would definitely recommend to people going into this kind of certification, is that Art was really well. And one of the things I tell anyone, if you're an auditor out there, is if you want to make things move within a system or an institution, money talks. So Art was really good about putting the value of losing or tracking assets in terms of what does that mean in terms of dollars. So in example terms, I'll give you an example. You can tell a hospital CEO or a healthcare CEO and say, hey, we stand to lose risk of several assets for the hospital, versus saying we have the risk that we cannot account for 10,000 items which are valued at $4 million. So there's a contrast as to how things are illustrated. And those ways are illustrated by good record keeping and tracking, like our department and the asset management do, and also by auditing, by showing the findings and risk as to what could the potential losses be.
So a question that relates to this comes from Marty Rowland, who has been working in municipal government for many years. And his instinct is, was anybody concerned that you're wasting your time? And that's what we hear from a lot, the resistance we hear in other industries. Was that there at all at University Health?
I don't think it was because there was no real tracking of certification at this point when it was being implemented. I think that once the ISO was done and we were forced by audit to do testing measures, and once people saw the value of the risk, because our audit department does risk-based, so we put this in our work plan. And so anything in our work plan is going to get ranked. So we have now validation of risk. And then once the audit's complete, now you have validation of potential risk and findings of potential losses. And so once you add the value of the risk factor and the value of the potential losses and revenue or money, in this case, I think then that's when people start less resisting because now they know there's a price tag to that risk.
Yeah, I think hospitals are a special environment because of all of the certifications for the doctors and nurses and equipment and things that are necessary to keep people healthy.
Yes.
There's just a readily accepted approach to certification. We've got to figure out how to bring that readily accepted certification processes to other industries. And I think you're right. It's explaining the profits and losses
Yes.
as a potential. So are you in the middle of another recertification, or where do you stand for the next recertification for your personal property assets?
I believe this year's a recertification are coming up. But one of the things I like to add before we get short in time is we as an institution have understood not only the value of all certifications in healthcare, but specifically the ISO certifications in healthcare. And so we submitted for the first time, we have an association that we're involved with called AHIA, and AHIA stands for Association of Healthcare Internal Auditors. So we got accepted to do a presentation, and for the first time, we're going to introduce ISO as part of healthcare system across the nation, and Art and I will be performing this topic for the first time ever. And so I'm hoping to promote other healthcare systems to adopt ISO standards and certification within their work environments. And so we hope that goes well, but we have one of the main presenting slot schedules. So I'm really hoping to put this out there on a more national level.
Oh, that's excellent, Frank. We're very happy you're doing that, and wish you all the best. If there's anything the ALN can do to support that, let us know.
Absolutely.
And I should say that University Health is a member of the Asset Leadership Network, and we've been mentioning Art Kurland, who is the Director of Capital and Asset Management for University Health, and Art is also an ALN Senior Fellow. He's been a great contributor. So, and it turns out that I'm going to be in Texas in June, and I'm hoping to set up something to come down and tour the facility. And it just occurred to me, we should talk with Art and maybe get some type of web program, broadcasting from University Health while we're there. Well, we'll talk about that later.
That'd be great.
Yeah.
Well, and just so if you want to get the word out to anyone else that's involved, is interested in auditing or anything, but we will be presenting at the 41st annual AHIA conference in Miami in August. And so if anyone needs the word on that, they want to see what that's about, but Art and I will be presenting on behalf of that. And we're going to discuss what the pluses are in having your institution being ISO certified. And then the second part is going to be how the auditing takes place into that, how it's conducted. And then what are the obstacles and what are the pluses in terms of auditing for sustaining ISO certification.
Okay, well, maybe you can tell us a little bit about that in context of, we've got a question here. What other ISO standards has University Health been certified to, or is this the first ISO standard?
This is, again, so this is the first one. And I believe our facilities management is right now in the initial steps of trying to get into that certification process. And once I think those two take off and leadership starts seeing the beneficiaries from this, we're hoping that our IT will come on board next with this.
Excellent. So why don't you talk a little bit about the challenges? Well, you have in the complexity of all the information, but can you tell us how much more information? Was it bigger than a bread box and all your other information are smaller than a bread box? How do you compare it to the other audits?
Well, it's been one of from my department, from the internal audit part, is that we have a large work plan. There are currently 7 of us in our department, and out of the 7, there's really only 3 auditors. And so the challenges become is, one, I mean, we know the importance of that. It's a component of having an internal audit as being part of the certification process. So we have to incorporate this with our other work products that we have. And so the challenge becomes that, okay, when am I going to make time for this? But Art and I think our external auditor are really good about giving a far advanced of when they'll be here, and it gives us appropriate times to plan. But nonetheless, it's still challenging because in our department, we also own the hotline. So a special project can come up out of a whim that our CEO will say, I need you to get on this right away. But at the same time, we cannot still take the focus of completing the ISO audit that is part of the recertification process.
Okay. So how is it working with ABS quality evaluations for the certification?
I think it's great working with them. One of the things I would recommend and put out to other institutions that are thinking of going into ISO certifications, I would say be mindful of your local regulations. And only I say this because as an internal auditor, we're always ready to, it's kind of like being an attorney. You know, you're not going to ever ask the questions that you already don't know the answers to. And so given that, in any, even when we do other internal audits, we give a certain amount of time for rebuttal, or for, you know, the people that are being audited to kind of have responses to some of the observations or findings. Well, it's no different from our outside. And so, and sometimes they're not aware of those regulations. So they're not aware that there's a difference. So for example, if you're going to get a national healthcare agency that's public versus ours that we're a health district, which is public and not private, there are certain different rules and regulations that apply to one and not the other. And I think sometimes the outside auditors are not aware of those rules and regs. So sometimes I'll get questions by the outside auditor as to, well, why didn't you do this? And my response will be, well, by regulation, I cannot do that. And so, and they're unaware of some of the regulations that are not applicable or difference in applicability from a private institution versus a public entity.
That's very interesting. Boy, Frank, I told you this half hour was going to fly, and indeed it did. It's just fascinating, this side of the certification story. So thank you for spending some time with us and helping us understand it. Is there anything that I did not ask that you thought I was going to ask?
No, not really. I mean, I think you got straight to the point.
Okay. Well, you want to make any closing remarks while I fire up the?
Sure. I mean, just in summary, I think that any healthcare entity that's going to want to go into ISO, I think it has a true value to it, whether you're a public entity or you're a privately owned corporation. I think ISO standards hold a real high standard, which from the audit and compliance perspective, keeps good internal controls, and it keeps good compliance standards that sustain accountability in not only achieving your ISO certification, but in sustaining it as well.
Excellent. Well, many thanks to you, Frank, for taking time with us today.
Absolutely.
Really appreciated this perspective, and it makes me think that we need to do something a little bit more formalized. Perhaps you can practice your presentation with our audience before you do it in August, or we'll talk about that, but
That'd be great.
we need to learn more about what you're doing. So thank you.
Absolutely.
And thanks to our patron members.
Thank you, patron members.
And thanks to our organizational members. We're having some talks with a couple other organizations this week, so we might be having some more slides. And thank you to our audience for attending today. Appreciate your interest, and we look forward to seeing you next week.
Absolutely. Bye-bye.